Hi everyone, welcome to Nick Barlow Radiology, and in this latest video we're going to be talking about the radiological evaluation of umbilical, venous and arterial catheters. We'll start on the UVCs, umbilical venous catheters. So these are commonly placed in preterm or critically ill full-term neonates in order to provide total parenteral nutrition and medications. If we look at this example here, let's zoom into this. We've got this line coming in here and it travels superiorly or cranially up to here. Okay, so this is your UVC. What we're aiming for with UVC placement is to be at the junction between the IVC and the right atrium. So the line comes in at the umbilical vein. It comes around here. It goes to the left portal vein, ductus venosus, which is around here, left hepatic vein, and into IVC. And the tip should be around here. The problem is that, these lines are inserted by pediatricians at the bedside. These patients are very small. Okay, so even a minor change in position can have a big effect on malpositioning. And the lines can either be too low, which is in this example. So this is situated around ductus venosus area here, or they can be too far. So they can either go into left atrium and beyond if they've got a patent foramen ovale or an atrial septal defect, they can pass through there, or into right atrium and beyond into the SVC. We want to avoid that because it comes with a whole host of complications, including thrombus, perforation. We want ideally the tip of the line to be here. So this will need to be reinserted. If we look, we can also see as a secondary little complication these lucencies here. So this is gas in the portal vein. This is due to the catheter insertion rather than any serious pathology, which it's normally associated with. But obviously, if you're introducing something external into a bloodstream, there's potential to introduce air there. So that's just a secondary thing to look for with UVC insertion. You can see this patient's also got an NG tube and the tip's positioned within the region of the stomach there. Bowel gas pattern looks within normal limits. There doesn't look to be any bony abnormality there. Okay, so we look at this example as well, guys. So you can see these patients are on CPAP, so these lungs are quite overinflated. We've got some peribronchial thickening there, looks quite busy, but no major consolidation going on. Heart size looks normal. Bowel gas pattern looks normal. No obvious bony abnormalities there to be concerned with. The patient's got an NG tube in place again, so we can see the tip of the NG tube here. We've got UVC coming in here, so it goes again into umbilical vein and then in a cranial direction up, with the tip now in optimum position. So this is at the junction between the IVC, right atrium, at hemidiaphragm level. This is a great position there. No gas this time in the portal venous system. But if we look, guys, we've got another line coming in here. You can see this one first travels in a caudal direction and then cranially. So this is an umbilical arterial catheter. So these are used for arterial sampling. The line travels firstly down the umbilical artery, then through the internal iliac artery into the common iliac artery and then into aorta. We've got to be careful that the line doesn't go into one of the branches off the aorta because it can block a vessel, or you've got potential to introduce a large volume of solution into that vessel. In an ideal world, you would want this in what's called a high position. So the high position is termed the safe region. This is from T6 to T10 level. So if we count up from here, we can see this is T12. You can see you can see from the ribs you've got T12, 11, 10, 9, 8, 7. So this is at T7. So this is fine. You've also got low safe position, which is L3 to L5 level. But ideally, you would want it in high position. Less risk of any complications. Okay, so that's your UAC and your UVC. I think for your CPD points, I think it's important to know what these lines are for and the key points of being able to assess a position on an X-ray. So the umbilical arterial catheters, the UACs, they allow for measurement of arterial blood pressure, blood sampling, and they're inserted through the umbilical vein. Okay, they travel in a caudal direction and they curl up back on themselves in a cranial direction up the iliac artery into the aorta. Ideally, the tip should be in high position, T6 to T9/10, or at low position, L3 to L5. Anything between that, so from L3 to T10, is an unsafe position. The UVC, the umbilical venous catheters, are for delivery of your fluids, medications, and nutrition. And the line travels in a cranial direction up the vein, through the ductus venosus, into left hepatic vein, and into IVC. And the tip should be at the junction between the IVC and right atrium at the level of the diaphragm. Okay, guys, thank you very much for listening. I hope you've enjoyed it. If you liked it, give us a subscribe, a share, a like. And if you've got any ideas for any future content, just drop them in the comments and I'll do my best to accommodate. But thank you very much for listening for now. Bye-bye. We'll see you soon.